Hello, and welcome to Complementary and Alternative Medicine, Defined Types and Integration. My name is Kenneth Nixon, and I'll be your presenter today. First, it's very important that we lay out what our learning objectives are for today. First, we'd like to define complementary and alternative medicine, which I'll be referring to going forward as CAM. Next, we're going to distinguish between complementary and alternative approaches. Then we'll move into exploring major CAM categories and therapies. And we'll finish with our discussion on integration into conventional healthcare, as well as our conclusion. First, it's important for us to understand exactly what CAM is. CAM stands for Complementary and Alternative Medicine. This refers to a wide range of healthcare practices, products, and therapies that are not considered a part of conventional medicine. These practices may be used in addition to or instead of conventional medical treatments. There are several types of subcategories of CAM, and many are used in conjunction with others. And we'll see that going forward once we get into the different types of CAM. Now, when we are comparing complementary and alternative approaches, we're going to start with complementary medicine. And these are medicines or therapies used in addition to conventional medical treatment. Whereas the alternative medicine approach are simply therapies that are used instead of conventional medical treatments. So, in essence, you can have an alternative medicine that is also a complementary medicine if you use that alternative medicine or therapy in conjunction with your traditional or more conventional medical treatment. However, if you use that in lieu, if you use that alternative medicine in lieu of complementary medicine, it then stands on its own as alternative medicine. According to the National Health Interview Survey conducted by the CDC's National Health Statistics Center, 40% of Americans have integrated at least one or more CAM therapies in any given year. This amounts to upwards of $34 billion being spent out of pocket every year. And the reason this number is so high is because most CAM therapies are not covered by your traditional health insurance. It's also important to note that this particular survey was put out a while ago. So it is very possible that these numbers, both in usage and the amount of money spent, has increased. As you can see, at least 40% of adults report using some form of CAM in a given year. And I think that people are truly looking for other ways outside of traditional or conventional Western medicine to take care of their health. And this can be for a myriad of reasons. And I also think that it's very promising seeing that CAM has made its way into about 60% of major US hospitals. Perhaps there can be education that helps with even more demographics joining along with the movement in integrative medicine. The top users of CAM are women, the college educated, and middle aged adults. I also have seen just, some anecdotal evidence when you're out and about, you see people doing things like yoga or practicing meditation, or these are things that you may have even done yourself that are low cost or even free. And we'll get into all of the different ways, or at least most of the different ways that you can partake in some CAM therapies or medication. First, we're going to talk about traditional alternative medicine, and this field includes the more mainstream and accepted forms of therapy such as acupuncture, um, oriental practices, and also known as traditional Chinese medicine, also known as TCM. And these therapies have been practiced for centuries worldwide, and they include things such as acupuncture, which is a traditional medicine practice that involves inserting thin needles into specific points of the body, known as acupuncture points. And it is based on the belief that the body can um, become unbalanced, and that can lead to illness. And in order to get that back together, they have to tap into the energy flow, which is known as chi. And they do that by using those thin needles to tap into those points and stimulate the body's natural healing mechanisms. Next, we're going to talk about Ayurveda. And this is a traditional Indian system of medicine that emphasizes the balance and harmony between the mind, body, and spirit. It is based on the belief that health is achieved by maintaining this balance through various practices, including herbal remedies. Ayurvedic medicine uses a wide range of herbs and spices to treat illness and promote well being. Lifestyle modifications is a part of this as well, and it includes dietary changes, exercise, and stress management techniques. And we also have Panchakarma, which is a detoxification therapy that involves 5 different treatments such as massage, enemas, and steam baths, amongst others. Next, we have homeopathy, which is a system of alternative medicine that uses highly diluted substances known as remedies to treat disease. And it is based on the principle of like cures like, which basically means that a substance that causes certain symptoms in healthy individuals can be used to treat those same symptoms in individuals that are sick. And lastly, we have Chinese or traditional Chinese medicine, also known as TCM. And this is an ancient medical system based on the belief that the body's energy, known as qi, must be balanced to maintain health. It is a holistic approach that uses a range of practices to restore balance and treat disease by looking at the whole person, including mind, body, and spirit. Key practices includes the aforementioned acupuncture, herbal medicine, dietary therapy, and exercises like Tai Chi or Qigong. Next, we're going to talk about the body and how touch has been used in medicine since the early days of medical care. People have been healing by touch, and this is based on the idea that illness or injury in one area of the body can actually end up affecting all parts of the body. And through manipulation, manually using your hands, um, those other body parts can be brought back up to optimum health. And what that allows the actual healing to the injured portion to do is to actually heal at the site of the injury or illness. And it's important to also note that body techniques are often combined with those of the mind. The first one we'll talk about is chiropractic medicine, which focuses on the musculoskeletal system, particularly the spine. Chiropractors use manual adjustments and other therapies to address spinal misalignments, improve joint function, and relieve pain. Osteopathic medicine refers to a unique perspective on healthcare that emphasizes the body's natural healing abilities, and it actually promotes a holistic approach to well being. Massage is a form of manual therapy that involves manipulating the soft tissues of the body, such as muscles, tendons, and ligaments, and it aims to promote relaxation, reduce pain, improve circulation, and enhance overall well being. Prior to partaking in this assignment, I never heard of body movement therapy, also known as BMT, and it's actually a form of psychotherapy that uses movement and dance to explore and address emotional, physical, and cognitive issues. It is based on the premise that the body and mind are interconnected and that movement can be a powerful tool for healing and growth. Next up, we have Tai Chi, which is a practice that involves a series of gentle movements and physical postures, a meditative state of mind, and controlled breathing. And last but certainly not least, we have yoga, which is an ancient Indian physical, mental, and spiritual practice that aims to unite the mind, body, and spirit. It involves a combination of physical postures, breathing techniques, and meditation or relaxation techniques. Next, we have energy therapy, which uses a variety of techniques such as hand placement on the body, crystal healing, sound vibration, meditation, and breathing exercises. The goal is to stimulate the body's natural healing mechanisms and promote the flow of energy. Reiki, which is actually originated in Japan back in 1922, their practitioners believe that there's a universal life force energy that flows through all living things. And when this energy is blocked or imbalanced, it can lead to physical, emotional, or spiritual problems. Reiki practitioners use their hands to channel this energy into the client's body, restoring balance and promoting healing. With the procedure, the clients lie comfortably on a massage table or sits in a chair, and the practitioner gently places their hands on or above specific areas of the client's body. And the practitioner may focus on these specific areas of concern or allow the energy to flow wherever it's needed. And a typical Reiki session lasts about 30 to 60 minutes. Next, we have Qigong, and it's a traditional Chinese mind body practice that combines slow movements, controlled breathing, and mental focus to improve balance, flexibility, strength, and overall well being. It aims to cultivate and harmonize the body's vital life force known as Qi to promote self healing and longevity. Qigong can be performed by dynamic exercises, dynamic movements with meditation, or stationary meditation, and its practices can be grouped into different types based on their functions. Next, the human diet. Diets and herbs. Over centuries, man has evolved from very simple diets of fruits, meats, grains, and vegetables to ones that contain foods rich in fats, oils, and complex carbohydrates. Unfortunately, with the conveniences of modern food and the varieties of modern foods, these things have helped contribute to a list of health challenges, including chronic illnesses. Nutritional excess and deficiency have both created problems in our society, and these imbalances have contributed to those issues with things such as heart disease, obesity, and diabetes. As a counter to these effects, many have gone back to nature to find balance by using food and natural herbs for healing and prevention. For examples, diets that are balanced and rich in fresh fruits, vegetables, whole grains, and lean proteins can help nourish the body and prevent illnesses. Meanwhile, herbs such as ginger and turmeric and root vegetables such as garlic have long been used for their anti-inflammatory and immune boosting properties. I've actually incorporated ginger and turmeric into my juicing routine. Next, we have the mind. And the mind, even standard or conventional medicine, recognizes the power of the mind and body connection. And studies have actually found that people with good emotional and mental health often recover faster and cope better with illness. And we're going to take a quick look at 3 mind based therapies that make the connection between the mind and the body. Number one, and one that's my favorite that I've been doing for a while now, is meditation. There are several different types of meditation. Meditation is a practice that involves focus and attention, often on breathing, a word, or a thought to calm the mind and reduce stress. Regular meditation has shown to lower blood pressure, improve concentration, and boost overall well being. The next is biofeedback, which is one that is absolutely new to me. I've never heard of this until this research. And biofeedback is a technique that uses technology to make you aware of your body's functions, like skin temperature, heart rate, or muscle tension. These sensors give feedback, allowing you to learn how to consciously control these processes, and it's commonly used to manage stress, anxiety, headache, and chronic pain. And last, we have hypnosis. And hypnosis is a focused state of attention and relaxation in which a person becomes more open to suggestion. Guided by a trained therapist, hypnosis can help reduce pain, change negative habits, and ease anxiety and insomnia. And just as a little anecdotal evidence, I remember being a critic of hypnosis when I was younger until my grandmother, who had smoked since a teen and had tried everything she could to stop smoking, was hypnotized. After she was hypnotized, she 100% stopped smoking cold turkey. I remember everyone in the family being absolutely surprised and shocked, but it absolutely worked in her case. Now, when we look at CAM integration, it is growing and it's being integrated into hospitals, as we spoke about earlier. As someone who believes in CAM, I find it that more people are using these therapies, and I love how they're using these therapies alongside traditional medicine. From treatment being openly discussed with patients to medical and nursing schools, including integrative medicine, things are looking really good for CAM. And as you can see by the graphic here, there's evidence-based inclusion, collaborative care teams, patient-centered approach, education and training, and research and guidelines. Um, it is very important to note that the fact that medical and nursing schools now include integrative medicine modules that actually focus on safety, efficacy, and cultural competence is really awesome, especially the cultural competency portion of CAM. In conclusion, in recent years, there's been a growing interest in combining CAM with traditional medical care in an approach called integrative medicine. This approach recognizes that healing just isn't about treating symptoms, but about caring for the whole person, including mind, body, and spirit. Many patients use therapies like acupuncture, meditation, yoga, and herbal medicine alongside conventional treatments. And when properly integrated, these practices can help manage stress, chronic pain, and treatment of side effects and improve overall well being. There are several benefits to integration as it promotes patient centered care, giving people more control over their health choices. And research also shows that some CAM therapies can enhance recovery, reduce anxiety, and even decrease the need for medication. There are also challenges, as not all CAM therapies have strong scientific evidence, and some herbal or supplement therapies may interact with prescription drugs, making it very important to consult your doctor prior to using this type of therapy. Ultimately, integrating CAM into conventional medicine represents a balanced, evidence based approach that blends modern science with traditional healing, to support the best possible outcome. Thank you so much. My name is Kenneth Nixon. Have a great day.